Good evening. This meeting is officially called to order. This is the Health, Environmental, Aging, and Disabilities Committee meeting for June 24th, 2026. I am the chair, Kobe Owens, for the First District, and at this time I will call the roll for the members of the committee first. Councilwoman Willhauer has asked to be excused. Councilwoman Cabrera,
Online.
she is online. Uh, Councilman Field,
No.
Present.
Councilwoman Cabrera present. Councilman Hackett
Here.
and Council President Congo.
Here.
Okay. As a friendly reminder, only members of the committee should be making motions and seconding. If there's any questions, we'll go to members of the committee first, and then the rest of council, then public comment. I would also like to recognize our council colleague, Councilman Chris Johnson, who has also joined us here tonight. I'm going to change the agenda up just a little bit to go to a resolution extending the period time for the City Planning Commission to consider and report to City Council on a rezoning application for 1010 Bancroft and 2140 West 11th Street. The sponsor is Councilman Johnson. Councilman Johnson.
Hey, good afternoon, Chairman. I appreciate you moving the agenda around. Thank you very much. I just wanted to first just talk about this item that's a resolution on the agenda. I believe we do have someone from Planning Departments here to speak to the piece as well. But this is essentially a housekeeping matter. This is a current rezoning application by a developer. And it was originally filed and referred to Planning Department in April 16th, 2026. So under the current city code, there's a 90-day time period. So this is essentially really just a housekeeping matter as we are continuing to engage with the public on this project. I hosted a town hall a few weeks ago regarding this project, and we are having robust discussions with the community as we continue to work towards moving forward as a West Side community. So it's just essentially a housekeeping matter. There's nothing substantive being voted on, essentially giving us more time for Planning Commission to review it with the builder and also work with City Council. So without further ado, Ms. Kaminsky from Planning Department, if you could just, from Planning Department's standpoint, if you could give any insight. Thank you.
Good evening. I'm Gwyneth Kaminsky from the Department of Land Use and Planning. This request tonight is related to the rezoning application, as Councilman said, for 1010 Bancroft Abbott Boulevard and 2140 West 11th Street, which is tentatively scheduled for the July 21st Planning Commission meeting. The code allows 90 days to review proposed zoning changes in order to prepare a recommendation to City Council. In this case, the original 90 days ends on July 15th, which falls short of the Commission's anticipated July meeting. We are therefore requesting a 90-day extension as allowed by code to extend the time frame in which the Commission can review the rezoning. This 90 days extends the review period through mid-October and would allow Planning Commission's review to be scheduled in July, or if requested by the applicant or council, in August or September if necessary. That pretty much sums up this. As Councilman said, this is largely a housekeeping measure, which is permitted by code. We've done it before, and it just affords more time for the developer and the city to work with the public on this rezoning matter.
Thank you very much.
Is there any questions from members of council? Any public comment in regards to this resolution? Is there anyone online?
I don't see, wait a minute, I don't, no.
All right, this will be on the July 2nd agenda.
All right, thank you very much.
Thank you.
And may I be excused?
Yes, you can.
Chairman, thank you.
Next, we will go to Councilwoman Cabrera's ordinance to authorize and approve the first amendment of a professional service agreement between the City of Wilmington and Northeast Bucks Company. Councilwoman Cabrera, and I believe you have someone
Yes,
from the admin team here as well too, Mr. Ford.
perfect. Thank you, Councilman Owens, Chair. Yes, we are presenting this ordinance, which is basically a housekeeping in reference to something that we need to do. We want to approve an amendment to this professional services agreement, as mentioned, between the City of Wilmington and Northeastern Bucks Company, PA Mullen Lonergan Associates. And speaking to this, we'll have a member of the administration come forward and kind of go over the details. Thank you.
Mr. Ford.
Thank you, sir. Tom Ford, Department of Real Estate and Housing, sitting in today for Director Weir. So as Councilwoman Cabrera said, this is an ordinance that authorizes the city to execute the First Amendment to a professional service agreement with Mullen and Lonergan to provide additional technical assistance to the City of Wilmington and its subrecipients. The agreement, as currently structured with its various extensions, have already been approved by City Council. It's the expanded services and the associated fees in this agreement is what brings us to council today. So essentially, the city would like to amend the agreement to increase the amount of compensation payable to the consultant in two different areas here. So specifically for year two, we're looking to increase the year two fee for service by $145,000, and we're looking to increase the fee for services in year three, year four, and year five by an additional $70,000 each year.
I'd like to start with a question. What's the reason for the fees going up from the original stated fees? Is it just cost of living? Are there additional services that we're receiving, or what's the cause?
Okay, thank you for the question. So I could break that down as we have two essentially separate increases here. The year two increase is essentially to accommodate the city's desire to provide additional funding for programs to address homelessness. This particular action was approved by City Council via a substantial amendment where CDBG public service dollars were reallocated to assist with the Code Purple program. And those dollars were essentially supplemented with home ARP dollars. So entities like the Ministry of Caring, Catholic Charities, Lutheran Community Services, and Family Promise are now recipients of home ARP dollars as opposed to their standard CDBG public service dollars. So those are essentially considered new programs which require additional technical assistance from the city federal consultant. As it relates to year three, year four, and year five, the 3 years that have essentially a reduced increase of $70,000 a year. That's for additional technical assistance to support the city with continuing to meet its federally related timeliness goals, which is a CDBG requirement, to provide technical assistance relating to new programs, which I just spoke about as it relates to home ARP, providing technical assistance for our various subrecipients, financial assistance to our finance department as it relates to reconciling IDIS, which is the federal accounting system, and the city accounting system, which is MUNIS. They also review our federal guidelines and compliance language in conjunction with the law department for our federal contracts, and just general guidance as it relates to our federal grant implementation.
Okay, that's very good. Thank you for that detailed explanation, Mr. Ford, as
Sure.
this is a concern for all here in the city. And that is, good. This was why I asked the question so people can understand why this was happening. I don't have any further questions. Definitely any questions from the council members or the public. You may proceed, Mr. Chair, with the
Is there any other
protocols.
questions from council members? Is there any questions from or public comment? Any members of the public? Seeing none, this will be, I believe, on our July 2nd meeting. And it will, for the full council to vote. Is
Thank you,
Councilwoman
Mr. Chair.
Harley
Thank
on?
you.
Okay. I'll go to Councilwoman Oliver's resolution. I talked to her earlier. This is a resolution expressing Wilmington City Council's concern regarding the relinquishment of the federal Head Start program by Wilmington Head Start Incorporated and the potential impact that it has on our students. Again, we got the notification about a week and a half ago that there was going to be a transition there. We have asked for an update to make sure that everything is still being provided and services are still being provided to our youth. I know one of their sites is in Councilwoman Oliver's district. I know she's been having a lot of conversations with them on this. So again, this is just to express our concerns about what is going on and making sure that our youth, our babies, are taken care of. This also calls for further transparency regarding the grant transition and advocate for continued availability of Head Start services for Wilmington families. She's calling on the Delaware congressional delegation to seek that transparency for us. Is there any questions from members of the council? Any questions from the public? If not, I would like it to be noted, I would like to be added as a co-sponsor. I believe Councilwoman Harley is still not on. Is there someone here from the city for her? All right. So I'll introduce this and we'll have you come up and speak. But this is an ordinance to approve the major subdivision plan for 501 South Walnut Street, Christina Crossing, and to authorize the city to accept the dedication of Howard Street, located between South Market Street and South Walnut Street, as a public right-of-way, officially name the dedicated street as Howard Street, and add it to the official city map. Yes, you're here to speak to it.
Yes, thank you. Thank you, Mr. Chair, and members of City Council, members of the public. Good afternoon. My name is John Kurth. I'm a senior planner with the Department of Land Use and Planning. I'm here to present Ordinance 26-042, which coincides with Resolutions 7-26 and Resolution 11-26, as well as Major Subdivision 26-01. Next slide, please. This aerial view image from Google Maps illustrates Howard Street as it has been identified since about 2009, when the Christina Crossing Shopping Center located at 501 South Walnut Street was completed. Since 2009, this private right-of-way has served vehicular, bicycle, and pedestrian traffic between South Market Street and South Walnut Street. Whether the users of the right-of-way were patronizing the ShopRite grocery store, any of the 10 retail businesses located in the buildings around the property's perimeter, or simply using it as a pass-through between major arterial streets, South Market Street heading south or South Walnut Street heading north. This private right-of-way also contains a stop and a shelter for the number 14 DART bus line. On February 24th, 2026, the Commissioner of Public Works for the City of Wilmington received a request from Christina Crossing SC LLC, the owner of Christina Crossing Shopping Center, and the adjacent right-of-way identified as Howard Street, to dedicate Howard Street to the City of Wilmington. This application was reviewed and approved by the City Planning Commission as Resolution 726 on April 21st, 2026. However, the required accompanying major subdivision plan was not ready to be considered in April due to the ownership signatures not being in place. So the project to subdivide the required territory and dedicate the street bed was subsequently reviewed and approved by the City Planning Commission as a Resolution 11-26 on June 16th, 2026. This ordinance will approve both the dedication of Howard Street to the city of Wilmington and the subdivision of 0.18 acres of land from the Christina Crossing Shopping Center. Next slide, please. This map illustrates the plan to dedicate Howard Street to the city of Wilmington that was approved in April 2026 in Resolution 7-26. This action from April and the major subdivision approved in June in Resolution 11-26 will allow Howard Street, a connector street measuring approximately 32 feet wide by 786 feet long and situated between South Market Street and South Walnut Street, to be added to the official city map and to be completed to city standards. Note the incomplete sidewalk sections that are adjacent to the entrances to and from South Market Street and South Walnut Street, but are missing in the middle section. This ordinance will approve the addition of land necessary to complete pedestrian access between South Market Street and South Walnut Street via the construction of additional sidewalks and curb ramps to bolster existing but incomplete sidewalks along Howard Street. Next slide, please. This photograph illustrates Howard Street facing westerly toward the South Market Street intersection. Note the completed sidewalk section and curb ramps. Next slide, please. This photograph illustrates Howard Street facing westerly toward South Market Street at the western edge of the shopping center and the DART number 14 line bus stop. Note the missing sidewalk sections here, which this ordinance will rectify. Next slide, please. This photograph illustrates Howard Street facing easterly towards South Walnut Street and the eastern portion of the Christina Crossing Shopping Center. Note the missing sidewalk sections here. Next slide, please. This photograph illustrates the intersection of Howard Street with South Walnut Street and identifies the eastern end of completed sidewalks and curb ramps that the new sections of sidewalk and curb ramps that will integrate into when the project is completed. Next slide, please. This slide is a rendering that illustrates the Christina Crossing Shopping Center's property that will be subdivided and dedicated to the city of Wilmington so that the selected parking spaces and portions of pad development sites that were just shown in the previous photographs can be removed and replaced with concrete sidewalks and curb ramps as to meet city standards. Next slide, please. This slide illustrates the major subdivision plan that dedicates the approximately 786-foot long by approximately 32-foot wide Howard Street right-of-way to the city of Wilmington as a public street, with the understanding that topographical realities dictate that full-length sidewalks can only be completed to city standards along the southerly side of the street. It is crucial to point out that this ordinance will, after 18 years, establish Howard Street as an official city street rather than an unofficial cut-through on private property has been the de facto reality for almost 2 decades. The pedestrian-friendly improvements that are included in this design will benefit not only the Christina Crossing Shopping Center and DART transit patrons, but looking forward, will tie seamlessly into the pending major development known as Riverfront East, to be constructed immediately west of South Market Street. Dedicating Howard Street and approving the subdivision that adds adjacent territory to the street bed through this ordinance will also support the construction underway at Luxor 2 site, a $13 million, 125-unit apartment complex adjacent to Howard Street that depends on an official city street to comply with fire marshal office requirements for fire lane access via a second means of egress. This action is a major step in completing the street grid in this area of South Wilmington. The Fire Marshal's Office, the City Planning Commission, and the Department of Public Works have approved the application of the owners of the Christina Crossing Shopping Center located at 501 South Walnut Street in South Wilmington to dedicate their private street serving the shopping center to the City of Wilmington and to accept the territory necessary to support a street that meets city standards. Next slide, please. In conclusion, this slide illustrates a closer view of the previous slide, just to zoom in a little bit. And it shows the Howard Street bed shaded in green, the sidewalk segments that were completed when the Christina Crossing Shopping Center was completed in 2009, shaded in yellow, and the new sidewalk sections and curb ramps shaded in orange to be completed as part of the dedication following the recordation of the major subdivision plan that adds 0.18 acres of territory to the Howard Street right-of-way. Next slide. Thank you. I will be happy to answer questions at this time.
Thank you for that. Is there any questions from members of the council? And I have no questions. Did Councilwoman Harley join? I don't know if she wants to give anything. No? Okay. Any members of the public like to give public comment in regards to this ordinance? Okay, this will be on our next,
Mr. Chair, can I ask a question?
yes.
Sorry, I couldn't find the hand thing.
Councilwoman Cabrera, your mic is
Using
breaking
that
up.
area, or we're just trying to connect the dots?
Councilwoman, can you restate that?
Never mind, I have a bad connection.
Okay.
It's okay.
Councilwoman.
Can you hear me better now?
We can, yes. Councilwoman
Okay.
Harley is here
Are
as
there
well.
pedestrians that are currently using that area that requires for the sidewalk to be built? Or are we just doing it because it was part of the original plan and we didn't finish it? Or do we foresee usage of pedestrians? That's the question.
Well, to answer your question, I was there last week, for example, just doing my field work, and there were four young ladies, and they were walking, and keep in mind it's only 32 feet wide, and the sidewalk's kind of cut off at either end, and they were walking in between, and they weren't going into the shopping center. They were like, it looked like they were heading from Walnut Street toward Market Street, and they were walking in the street. So it's just crucial for pedestrian safety, and it is part of the larger plan.
All right, that sounds good. Yeah, safety is definitely number one. I was trying to picture where it was, but now I got a better idea. Thank you.
I would like to give Councilwoman Harley an opportunity to speak if she wanted to speak on this ordinance, seeing that she is the sponsor.
Yes, well, thank you, Mr. Chair. I just wanted to jump on, to say that based on the, conversation and information that I have, that I definitely am in support of it. It's sort of like a paper street that is really, to my understanding, that has not been used, and based on what they are trying to do in terms of redevelopment. We have already invested money around infrastructure along Market Street. And so this is just another step towards us being able to just bring in more, as we call it, we need more revenue and more development. And this is, again, one step closer to what we have been discussing. So I'm definitely in support of it. And I apologize that I can't stay on, but I did want to connect and just acknowledge that I'm in support of it, and I'm looking forward to it being voted on the floor. Thank you, Mr. Chair.
Thank you, Councilwoman. Very similar to what both my council colleagues said. I shop at that ShopRite all the time. There's people walking back and forth to the hair store, to the Domino's, to ShopRite. There's a few restaurants over there, Wingstop. So again, this just adds more safety for our residents to make sure
Yes.
that they, are good to go. So I look forward to supporting this. And with that, this will be on our July 2nd meeting as well too. And with that, I will move to our next presentation, and that is we'll go to the Christiana Park challenges from the Impact Life crew. Feel free to take a seat.
Are you gonna stand? No. Okay, so I get anxiety. Good evening, council members and the members of the community. First and foremost, thank you for allowing us the opportunity to speak tonight. My name is Leslie Palladino, and I serve as the Director of Overdose Prevention and Outreach at Impact Life. I'll let Brian introduce himself with his role as well.
My name is Brian Dietz. I'm Chief Operations and Compliance Officer for Impact Life.
So our intention in being here is not to criticize any individual agency or decision that was made. The purpose is simply to raise awareness about some of the barriers we have encountered in serving residents at Christina Park and the impact those barriers have had on individuals experiencing homelessness. Many of the individuals currently residing at Christina Park were connected to our outreach team long before the site was designated as a sanctuary. Some of these individuals I have personally worked with for more than a decade throughout my career. We have built relationships based on trust, consistency, and continued engagement. When the contract was awarded to a new provider, we were informed that outside providers could not enter the site or provide services without prior authorization from this new awarded provider. Following that change, I made 3 separate attempts to establish communication, both written and verbally, so that our team could continue supporting the individuals we had already been serving. Unfortunately, those requests went unanswered. We also attempted to engage with local officials regarding those concerns, and we did not receive a response on that either. At Impact Life, our only goal is to be a part of the solution. Because our team works directly with individuals experiencing homelessness, substance use challenges, and complex health and social needs throughout Delaware, we are not hearing about these issues secondhand. We are seeing them and responding to them in real time. Our outreach model is designed specifically to reduce barriers by bringing services directly to people where they are, to meet them where they are. These services include healthcare and behavioral health navigation, housing connection and ongoing support services, workforce development and employment opportunities, harm reduction services and basic needs support, consistent relationship-based engagement that builds trust over time. And our team is prepared and able to mobilize quickly to support residents through on-site peer support and engagement, care coordination and housing navigation, healthcare linkage and behavioral health referrals, workforce readiness and employment support, and then harm reduction education and services. In addition, Impact Life operates certified recovery residences serving specialty populations, including individuals who are justice involved and members of the LGBTQIA+ community. We also operate statewide resource hubs and a Wilmington drop-in center that provides showers, food, clothing, doula support, housing navigation, and referrals. My request tonight is simple, that all qualified service providers willing to support these residents have a seat at the table. No single organization can meet every need of every individual experiencing homelessness. The strongest outcomes occur when providers collaborate, coordinate services, and work together towards the shared goal of helping people move forward towards stability, health, and permanent housing. The people residing at Christina Park deserve access to every available resource our community has to offer. Thank you for your time and consideration.
Thank you so much. So I can at least start. I'm sure, as you know, the mayor made a decision as of June 15th to shut down the Sanctuary Park as a place where individuals could be out there. Since then, they have been dispersed into other organizations or motels where they have a 14-day stay. We're already a weekend. Homelessness is not something that's going to go away in the city of Wilmington. It's just because this park closed does not mean that it's going away. It's going to be something that's very real. So I do agree with y'all that more coordination of multiple service providers need to be had. And again, I want to reiterate for everyone, homelessness, not everyone in the city of Wilmington who is unhoused was in Christina Park. And I think services like y'all, and I know a few people on your team, services like y'all are critical to making sure that people who are in some of their lowest points are still respected and seen as individuals and humans, and receive the additional help that they may need to get back on their feet. My first question is, how can we better coordinate with y'all as a council?
So, I mean, I think the simplest way is if you guys see a need, that just reach out to us if it's something that we can fit. I mean, we serve statewide, but the majority of our time on the streets is dedicated to Newcastle County just because of our location. So we get real data based on spikes in overdoses, new encampments that pop up. So just kind of reiterating, I think it's a collaborative effort. So if there's stuff that we see that we could use your assistance or support in, and vice versa, is a good place to start.
And with the encampments that you deal with, do you provide any additional services outside of just overdose and drug?
Yes, so we actually have two separate funding sources from DSHA for the Home for Good program. So one is the innovation, which is dedicated to people that are experience literal homelessness. So there is an outreach specialist that's dedicated 40 hours a week to that. So that is everything from emergency shelter placement, any referral really under the sun. I think one thing about us is we really do appreciate the collaboration. So if it's a service that we don't offer, we at least can do a warm handoff, not handing them necessarily like a card and saying, hey, figure it out. We physically will transport them to do a warm handoff. We just want to make sure they get the services that they need, whether it's us or other agencies.
And what has your success rate been with the individuals that you have engaged with?
In terms of like placing them or just, so our satisfaction survey internally for like residents and clients that we've served is 92%, something like that. Our goal is, unfortunately, we can only work with the autonomy that the human has. So it could be anything from small wins where they've got placed in a shelter and that lasted for a couple of days. And unfortunately, then they're kind of displaced again. But that can kind of vary in a lot of different ways.
So to add to that, if you're looking for like essentially long-term outcomes data, we don't have that long-term outcomes data at that point. At this point, sorry.
And how long have y'all been around?
6 years operation, yeah. I can tell you for the Newcastle County placement on the innovation side, we've served 78 individuals to date, and that started in February 1st that we launched that grant specifically. And that services include everything from shelter placement, food necessity, clothing providing, them coming to the drop-in center and getting showered. We sign them up for case management services. So the beauty, I think, of some of our different locations in Wilmington is it kind of caters to two different populations. So if it's very much in walkable distance between each other, so if one person kind of shows up at the cafe and needs services on our end, then it's a very easy switch.
And where's the cafe located?
Right on Union Street, 810 North Union. And then we have a drop-in center that kind of serves geared a little bit more towards the unhoused in Trolley Square, North DuPont and Gilpin Avenue. It's the back end of Trolley, yeah. Between the laundromat and the barbershop is the easier way. Most people know, yeah.
All right. Okay. I think that was all the questions I had. I will open it up to members of the committee. Is there any questions from my fellow council members? Seeing none, I did have one more question. Working in this space, I know some individuals may have criminal backgrounds as well too. Can you speak to the work that, if y'all do any work in regards to the reentry side of things as well?
Absolutely. It's actually kind of one of our specialties. So we actually just opened a women's house and a men's house that's dedicated to the reentry population. So that's specialized case management that's on site there. That's anybody that's maybe recently released from prison, maybe they're on probation. Even if that's a person that's absconding from probation and is now unhoused on the streets, we have outreach that kind of is dedicated to that as well. Just we can work with anything as long as they obviously give consent and we're able to do so, coordinating with like a probation officer to see if there's any way we can kind of work it out, getting them placed. Yeah, so it's definitely a population that we cater to for sure.
Both those houses are located in Wilmington.
So they're in Bear, Newcastle County, but it's specific to Newcastle County residents. So if they're a Wilmington resident, they're eligible and meet the criteria for those locations.
Okay, thank you. Councilwoman Cabrera. Councilwoman, your hand's up. You have to come off mute if you're talking. It may be her connection again. Okay. Is there any other council members? Seeing none. Any members of the public? Okay. Let's give it one more second, see if Councilwoman Cabrera jumps back on. Y'all don't mind.
Oh, yeah, no worries. The catchphrase since 2020 is you're on mute, so we we get it.
Is she back? Councilwoman Cabrera? Okay. All right, we will move forward. Thank you all so much for being here today.
Thank you for
and,
having us. We appreciate your time.
I definitely look forward to staying in contact with y'all.
Yeah, awesome. Thank you, guys. Have a good night.
Next, we will have Chief of Staff Elijah Simmons and Policy and Outreach Director, Policy and Research Director, Kendra Brumfield Nwanga.
Alrighty. Thank you, Chair Owens. My name is Elijah Simmons, Chief of Staff for Wilmington City Council, and I'm joined by
Dr. Kendra Brumfield Nwangna, Legislative Policy and Research Director for City Council.
and we are coming to you today with the Health, Environmental, Aging, and Disability Strategic Priorities. Next slide, please. So what we are trying to accomplish today we're going to walk through the priorities that were raised during Councilmember one-on-one discussions, and then we're going to compare and show how the chair's priorities align with the themes raised by other committee members, and then we're going to discuss and have an open the floor for feedback, questions, debate, and points of agreement, and then we're going to choose a pathway. We're going to begin narrowing towards projects, legislation, and initiatives the committee can work on. Next slide, please. How we got here. We got here back in January 22nd, where we had a meeting where there was agreement that the priorities would be refined through the standing committees that we are at today. Then we had one-on-one discussions with the different committee members where we asked them what their individual priorities were for the different assigned committees that they're a part of. And then we aligned some themes. We looked at the themes and the objectives, and we identified them across the different members, which brings us to today where we're having the committee discussion where the members are going to discuss, debate, and begin consolidating a committee pathway. Next slide, please. So for the open discussion guide, the goals are going to be to get consensus, to see where you all agree on, then to present some action items, what project, initiative, or legislation can move forward through these priorities, and then you're going to clarify, see which priority needs more definition before any action is taken, and then find some accountability to see if there's any data or reporting you may request. Next slide, please. And then for next steps is to capture feedback, document where you all are aligned, where you may disagree, and what may need more work, and then refine the priorities, consolidating the discussion into a clearer committee priority statement for the strategic plan, and then to identify actions, name potential projects, legislation, initiatives, or reporting requests. And then the end goal is to compile all of these finalized and approved priorities into the final strategic plan document. Next slide, please. Dr. Kendra.
So I will say for all the members of the public who are here or those who weren't at the previous presentations, when we did the one-on-one sessions with council members, they didn't necessarily expect this format. We just thought having the chair's feedback and the committee members' feedback side by side would be helpful for structuring the discussion. So with that being said, I will go into the themes that we were able to identify from the feedback that we got from the committee members, and then open it up to you all for discussion. So one of the first themes that was very clear was the homelessness response and coordination. And the feedback from the chair of the committee was to expand permanent supportive housing and improve coordination of shelter resources. From the committee members, the feedback was to develop a clear understanding of the city's homelessness strategy and available resources and coordination efforts, and to receive regular reporting on the homelessness related efforts and outcomes in the city. So with those, that feedback, we wanted to open it up to discussion on what those objectives might look like. Do you feel like this is an appropriate theme for the feedback that we were able to identify?
In regards to what we talked about, I think expanding permanent supportive housing and improving of the coordination of shelter resources is always going to be key and critical, and it's very reflective of what I was envisioning for this committee. I know as someone who has a shelter in their district, that relationship hadn't always been there with the city. That is now since changed, and I'm hopefully it's better coordination with all the different shelters that are still in existence on the city side of things.
And I would also mention that having the strategic plan gives us an opportunity to update you on things like the state legislation related to zoning for recovery housing and group homes and things of that nature. So we can also add that to the things that will go into the strategic report, is keeping updated on that. And also things like the homelessness subcommittee are already in the works related to this theme.
And if I can really quick, kind of touching up on what Dr. Kendra said towards the end, one of the cool things about this specific topic around homelessness response and coordination is that this committee has already tapped into that through the establishment of the homelessness subcommittee. So when people look back years from now at what the 109th session Health, Environmental, Aging, and Disabilities Committee, their priorities were, they'll be able to see this topic and see the different items of establishing the homelessness subcommittee as one. So that's just one of those scenarios and situations where try to think about other ideas that can expand upon this specific category.
So if no other thoughts, we can go to the next slide. So then the next theme that was very clear to us was senior well-being and support. And some of these, the feedback from the chair included strengthening oversight of senior housing conditions, and that would be through rental inspections for senior high-rise buildings, exploring the creation of a senior check-in program, somewhat similar to, I believe it's Newcastle County that does a well check program. From the committee members, the feedback was building a stronger understanding of the challenges facing seniors. And I think this would relate to aging in place is kind of the thing that I drew from that. Reviewing participation and outcomes of senior-focused programs, like the Senior Tax Credit Program, and examining overlapping financial burdens. The other feedback was expanding opportunities for senior socialization. As we know, loneliness is a huge problem for seniors, and engaging citywide programming, community-based activities, and listening sessions with seniors in high rises in particular. Creating strong intergenerational programs, connecting seniors and youth through mentorship, shared activities, and skill building activities, and also continuing oversight of living conditions such as property management responsiveness and support services for seniors in high rises. And so with that, I will open it up to if you feel like this theme is appropriate and the objectives that are listed here.
I think both sides kind of blend well together and better coordination to make sure that we're lifting up our seniors. I see Councilwoman Cabrera has her hand up. Councilwoman Cabrera.
Thank you, Mr. Chair. So thank you very much for the report. It is very concise, and yes, you captured our voices, our concerns, and that of the community. So I think you've done an excellent job with it. There's some things that you mentioned there that I think are really important. I can speak to a few examples. Recently, like Luther Towers is one of the places that I'm the most communicating with. They're always calling me about an issue or another. And, there's sometimes days go by before someone passed away. They're deceased in their apartment before they're found. So I love the idea of that, and this is what I suggested to them. You guys should have some kind of way of checking in every floor, put a floor captain and take turns checking in with the seniors to make sure that they're okay, that everybody's accounted for. And, of course, I got some push, oh, how are we going to do that? Who's going to do it? But whatever. We'll work out the details, but that is really important. Another issue that I'm working on currently with the administration and drafting legislation is requiring that these high-rise buildings all have working air conditioning units. We saw some really bad situations last year where the main unit broke, and then not every resident was given a floor unit as a backup. But they went days during a heat wave without any air conditioning. So those are two issues that are very near and dear to my heart. And of course, with the listening sessions, that's something that I started with the last session. And every time we turned around, there was a COVID outbreak, and it kept us from continuing. But we did get to at least 10 of the high rises. But I think that that is something that even we as council members can do. And I invited other council members and state representatives and other elected leaders to come to those opportunities and speak. The other thing is that Wilmington Housing Authority Director Fitzgerald already conducts these listening sessions, so we piggyback with what he was doing, because that's another way to hear what their concerns are, especially management. Are things being taken care of in these buildings? And then not forgetting the seniors that live at home, how to engage them in the community so they're not forgotten. So I'm really looking forward to the work that's going to be done in this area, working with our seniors, our very vulnerable population, and how we as council members can further engage. So job well done, listening to our concerns, and again, looking forward to working with my colleagues on implementing some of these and expanding the ones that we're already doing. Thank you.
Thank you for that. Any additional council members have any feedback? Seeing none, you can continue.
Thank you. Next slide, please. So the next theme that was also in the feedback that we were able to identify was community health and outreach. And from the chair, we heard feedback about food justice and neighborhood sustainability initiatives, including community gardens and local food access programs. And the committee members spoke about expanding public education and outreach regarding healthcare access, insurance changes, and enrollment options, and also encouraging public-facing healthcare awareness through fairs, education campaigns, and neighborhood-based outreach. And I would also like to mention, just as a caveat, this wasn't directly in the feedback, but just based on other exchanges with the council members, as this is the health and environmental, is that that may be something that you might want to consider including in as a public health sort of concern. And also individuals with disabilities may be somewhere in your consideration. We weren't able to put it into these priorities, but just putting that there for you all to consider if you wanted that to be a part of the strategic priorities as well.
So in other words, something in reference to the environment and then something in reference to folks struggling with disabilities. What can be included in the overarching strategic priorities as the committee is environmental and related to disabilities? Just kind of brainstorm with those ideas, if you have any now.
And that's something that, you may want to follow up on as well. And I would also say not to overstep the public safety, but sometimes gun violence in policy terms is also considered as a public health issue. So just throwing those out there, you don't have to answer now, but opening it up to discussion about community health and outreach as a priority.
I think that can definitely be added and should be a top priority, especially when it comes to individuals with disabilities, whether they're visible or not. Making sure that this is a city for all people to be here and thriving.
Jamila Davy has her hand.
There is one member of the public. Before I go to that person, is there any additional council members who have anything? No? All right, we'll go to public comment. Jamila Davy, sorry.
Hello, Chairman Owens and Council. I was definitely out here thinking about the environmental column, so I was glad to hear that brought up. I know this is an interesting committee, the one that doesn't exactly map to as much to a administration department and has crosses a lot of areas. So there's a lot of different areas to cover. But, I have been in chambers to see presentations on extreme heat. We presented on, community gardens here. And I'm working a lot on the tree canopy, and I, definitely want to, you know, I have an aspiration to see our city council help lead on some of these issues, working on trees. I know that's like a department of public works, right? That's from the operation side, but from a policy and public health perspective, just as Elijah and Dr. Kinder were speaking, is a public health issue. So, would love to see, more coordination and strategic priorities on that front too. And I'm looking at, we have healthy and thriving communities and the sustainability pillars in the comprehensive plan. And I'm thinking about some things that Councilwoman Cabrera was just speaking about too. I know as I work with extreme heat researchers, that one of the approaches they have to talking for dealing with extreme heat. I mean, I was at this conference that they have we had our first extreme heat, awareness week in the state of Delaware, right? And they brought together all kinds of, city people and state people, DENREC people, health providers, and it turns out, the people that are most vulnerable to extreme heat are people are aging communities and our children. Like, and I learned all this cool stuff, like, kids are vulnerable because they have their the surface of their bodies compared to their mass, that ratio is higher. There's more surface, so that they get heated up, and then they're more vulnerable because of that. And then for our elders, like taking certain medications can make it very difficult for you to weather extreme heat. So, and what we see in our communities, especially in our urban core, is that at night in the summer we don't cool down. These areas of town. And so there's nights that are hot. So we need those things that Councilwoman Cabrera was talking about, the networks of care where we have built-in ways of checking in on each other, as a matter of course, in the case of extreme heat. And we have issues with trees, and it's a legislative issue. The way, the code is written, there's a lot of, we need trees to cool down our streets and to clean our air and to help our nervous systems across our communities. But we have less access in some of our more denser areas. And our code, as it reads, really exacerbates that. And I don't think the city of Wilmington's practices, they don't just practice the kind of challenging areas, the challenging way the code is written. The way the code is written, like street trees, are the purview of the city of Wilmington. You have to have a permit to do something to them. But once they are hazardous, they become the responsibility of the adjacent property owner. And that, that's really problematic when we want to have equitable access to trees in all our communities, just whether or not they have, tight right of ways, or whether or not, they've experienced historic disinvestment, and need additional support to like make trees possible. So I would love to see this committee, to play a role in helping to address those issues. Thank you for the time.
Thank you so much. And I agree with you. I remember the first committee meeting being about heat mitigation here in the city of Wilmington, and working with organizations like yours and Sierra Club to continue to make sure that that is at the forefront of our mind as well too going forward.
One last comment in relation to disabilities. I think I can give a shout out and kudos to this session of council where we have taken steps to care for those who may be hearing impaired by having live translation and live captions at our council meetings, even for this committee meeting where we have a subscription called Wordly, where we're utilizing that platform that can not only translate in dozens of different languages, but also for those that may be hearing impaired, they can look at live captions of our meetings. So that is a step that we can put in there once we start crafting and making the strategic plan as it relates to disabilities and what this council has done.
Thank you so much. With that, is there any other public comment? We have one more person, Lip Bentley. Can you raise your hand, please? If you're still on. And you have 3 minutes.
Howdy, can y'all hear me?
Yes.
Thank you. Yeah, I just well, just to comment on a few things I heard. I know over on the west side recently there were some trees that were planted on a portion that's like, I don't know if it's included in Canby Park, but it's right next to Canby Park. So I definitely want to encourage more of that. And just a general thing I wanted to speak about is just the situation with the folks that were living in Christina Park and they're now in lodging elsewhere. And it's just to mention, especially with it getting hotter, that it looks like, and this is, more addressed to the Carney administration really dropping the ball, not necessarily, with what city council's been doing, because I think you all have done your best with addressing the situation, but just wanted to mention that, a lot of these folks do not have transportation, and they're, from what I've heard, because I've myself have taken food out to one of the motels that these folks are living at. I've taken food out there. That there's, a lot of the people that were helping to feed the people to help them survive at Christina Park are ones that are, on their own time and with their own money are delivering food to these folks, because a lot of them do lack transportation. Being homeless, a lot of them do not have income. Some of them do have jobs, but most do not. Most are having a hard time, getting around to get food. And it seems in a lot of cases that the same volunteers that were taking food to Christina Park to feed these folks are the same people that are helping to feed them today. And it's an effort where there's a small amount of people that are doing this. And it's an effort that, folks can't get out there every day to do this. So I just wanted to comment on that. And again, I know that, the situation is mostly the responsibility of the Carney administration. But I just want to emphasize again, they've really dropped the ball, and it's just really inhumane and disappointing. And yeah, and I also just want to mention, in reference to Carney's veto of the housing trust, I would love to see City Council override that vote. Please do so. Councilmember Owens, I liked your comments that I read in an article from Delaware Public Media, excuse me, and also Councilmember Darby. I appreciate her comments as well. So, City Council, please override Carney's veto. We need support for people so they don't become homeless, and we need support for those who are homeless. And I am from the 6th district, in case John Carney's administration is listening. An almost lifelong member of the 6th district, John Carney, and I was also raised Catholic. And I think you're a joke. And anyway, that's all. Thank you very much.
Thank you for your comments. With that, I believe there's no more public comment. And I think that is it for our agenda tonight. With that, I will entertain a motion to adjourn. Is there a motion?
President Congo.
I'll make the motion and I'll second. And all those in favor of going home, say aye.
I'll second.
Aye, there we go.
Aye.
Aye.
All right, we're adjourned. Thank you, everyone.
All right. Thank you.
Make that one, yeah?
You.
Guess what?